Hi, my name is Dr. Professor Tom Cherian. I'm the founder of South Asian Liver Institute. South Asian Liver Institute and Wockhardt together now I hope to bring you a great service for liver patients. One of the things that always hurts me and makes me feel a little bit bad is the sheer amount of money that you need for good quality liver treatment. So a liver transplant is expensive and outside the boundary of average people in India is what I always worry about. But after having done nearly 300 transplants in India now, I feel that not doing a transplant is not cheap either. Let me give you an example. About a year ago, I transplanted a young child who was only 11 months old. That child had been admitted in approximately 4 to 5 different hospitals for about a week each time, in ICU sometimes. And each time the bill of the hospital for the father was about 2 to 3 lakhs. So if you count it all, he had spent more than 13 to 14 lakhs within those 11 months that the child had been alive. And at the end of that, the child without a transplant would have died. So my point is, liver transplant or liver surgery is required when there is no other option. But when it is required, it is cheaper to have a transplant done rather than have 7 admissions, each time getting worse and worse, and each time getting sicker and sicker, and then finally having a poor outcome after having spent the 20 lakhs. It seems to me to make sense that you spend that money, unfortunately, if you do have the liver disease, but spend it wisely so that you have a patient who is alive at the end of it and who can lead a normal life. Most of my patients are back at work, earning their own livelihood and after a transplant, and just like blood pressure, they have 1 tablet in the morning and evening, and that is all. It doesn't mean that you cannot work. Most of them are back at active work. I hope this is a sensitive topic. I hope this brings some clarity into the costing of transplantation.